that's what makes it so hard to build in this space, because you need legitimate, novel science, and you also need to be excellent at market and branding and serving a real need for customers that they can immediately feel.
Hey, Karl, how's it going?
It's going really well, Erum. You just got back. Where were you? What did you do?
I just got back from Montreal, which was a 12-hour trip on the Sunday after the 4th of July. The biggest thing you should not be doing is what I was doing, is being stuck in traffic that last day of vacation, which in the grand scheme of things was fine. You know, I would say my husband and son, they were chill to drive with. My son wasn't getting too crazy. He had a lot of music requests, so we had to just make sure we were DJing for him. He is 4, so. But he has some good taste.
Normally, that's an 8-hour drive. And what's crazy is it takes as long to take the train there as it does to drive, which is crazy because Montreal should only be like 2 hours away from New York City, that is.
Yeah. But we had the car because we were driving around Montreal. We went to Quebec City. It was beautiful. We had a great time being immersed in the Quebecois culture.
Yeah, no, the food is great up there. I love Quebec.
Oh my God.
I love Montreal and I love Quebec. Yeah.
It's so good. Well, maybe we should do a messaging lab Canada up there, because there's a lot of biotech companies. I mentioned in the previous podcast, I met with a few of them, and I have a couple of friends that live there, and they really are like, you got to move here. You got to move here. And I was like, I don't know. Brooklyn's pretty good. I mean, it is its own bubble, right, Karl?
Quebecers will hate me for this, but those winters are damn long,
Yeah.
And damn cold.
Yeah, damn cold. But they were like, oh, it's a dry cold. It's its own culture. And Huga, you can get really cozy. You just need to know it's not the weather, it's the gear. It's never the weather, it's the gear. So I just got back and you're about to leave. Where are you going?
So I'm going to go hike in northern Spain. Whenever I say that to people, they ask me, are you going to go hike the Camino, which is the Camino de Santiago, which a lot of pilgrims do. I'm not doing the Camino. I'm going to be hiking in the Picos de Europa, which is the peaks of Europe. It's right on the Cantabrian Sea. It's supposed to be like the Alps of Spain. We'll see what it's really like. But we're going to go to Bilbao, then we're going to go to the Picos and hike there for a little bit more than a week, and then spend some beach time and then come back. But there's been a lot of great stuff going on. Erum, you're worried that ChatGPT is atrophying our brains. Why?
Yeah, so I came across this Instagram post, and it was interesting because MIT just completed the first brain scan study on ChatGPT users, and the results are very interesting. The 4 months of data revealed that 83% of people who use ChatGPT to write couldn't remember anything they wrote just minutes later.
Yeah, I mean, here's what I want to say about that. I think if you're using AI to write for you, you're cheating. And I know a lot of people do it. I'm not surprised that people are saying that it makes you dumb. But I also wonder, were there similar studies that came out when search engines first came out? Because people would just search for stuff anyway. I know AI is at a different level. I'm not going to debunk the study because I believe what MIT has done. But I also think that we're all looking for ways to use these technologies. And I think when you work with them, it's not necessarily going to make you dumber.
Yeah, it's just a lot to process. I mean, one thing they also said was that the neural connections in your brain crash from 79 to just 42. So that's a 47% collapse in neural connections being made. I'm reading this actually, and they're using words that are pretty biased. I mean, your neural connections crashing. I don't know if that's the actual scientific term or you're just not using as much of your brain, but maybe you're using your brain for other things. I do feel like the challenge would be in the critical thinking, because if you're not using your brain power to make the connections between concepts yourself, then it's like, okay, if you don't use it, you lose it type of situation.
Totally. Yeah, I agree with that.
I think for us, because we do use AI throughout our work, maybe we need to have a policy on using ChatGPT. And then also there's other ways to move your mind and move your brain. There's things that we talk about here on the Do Everything podcast when it comes to biology. And there's so much depth and also high level thinking that needs to happen when you're thinking of what goes on the DNA level and you're working up the layer of complexity to societal norms and how we operate as humans.
I think a couple episodes you said, Erum, that IRL or in real life is going to become even more important. And it's something that we talk about with our clients. It's something that we talk to our friends about. We go to a lot of events. We end up meeting people all the time. We've got multiple communities that we've built. And so I think AI becomes like a work partner very easily. People will depend on it to get their work done. Lots of jobs are going to get lost. But what's going to become more important is those real world connections that people create and have with each other. And I think that those connections can be augmented by our use of AI as a knowledge source or to question us or whatever. But I just do think that you're pointing out something that you've pointed it out a couple times, and it's going to become more important.
Yeah, it's a good point. Very good point. So there's always new news. So you share with me this interesting story, and I love hearing health stories when it comes to animals and pets. There's an article you sent about stem cells being used to take care of your pets.
I read this article in TechCrunch that said that this company Gallant, which is a San Diego-based biotech company, just raised $18 million. In their release, they said they're about a year away from having stem cells ready for pets. And the first thing they're going after is a painful mouth condition that cats get called feline chronic gingiostomatitis. So we've talked about dogs and livestock as being really important markets that often get neglected by people who are working in biotech. And yet, if you want to get a product to the market faster, sometimes it could be a way to shortcut your entry into the human market. I thought that this was a really interesting story, and it fits into our Grow Everything thesis in that everything will be grown, everything should be biological. And while we don't often do stories or do put a lot of focus on the biopharmaceutical industry, even though we work in it, it's interesting to see that here's a company that fits our thesis that pets are a really great market to go into, and they're moving really quick. And one of the places where pets have been used was in the biohacker market. There's this guy down in Mississippi who was trying to hack his dog so they would glow in the dark. That was one of the first people I was exposed to who was really doing livestock or dog biohacking. Now there's companies where you can buy a clone dog or a clone cat. I think they're like $10,000 each. But biohacking has been a theme that we've had on this podcast several times. Erum, what do you want to talk about when it comes to biohacking? Because we're leading into our guests.
Yeah, so biohacking animals, definitely. There's a lot of new therapies that are coming out. So we're not breaking any news here. Everyone's heard of resveratrol and NAD plus and NMN and these other longevity therapies. If you haven't heard about it, I mean, we're going to be talking about it in this episode with our friend Shelby, who works at Compound, an investment firm focusing on very deep tech. And she'll talk about the thesis. It's really interesting. But longevity is a part of that, or biohacking or bioacceleration. There's different terms for it. And you're talking about pets, and one of the therapies that is very interesting is the follistatin cell therapy. And that was tested on dogs and mice. And when this goes on video, you'll see it on video, but we'll put it in the show notes. These dogs are jacked. These mice are jacked with follistatin cell therapy. And this is a cell therapy that's being offered in this crypto city called Prospera, Honduras. And the company that has this therapy down there is called Mini Circle. But anyway, so there's a lot out there and a lot of leading thinkers. We saw Peter Diamandis at Beta this year, and he invests heavily in longevity. He also invested in friends of ours. They have a company called OneSkin. And there's other leading thinkers like Aubrey de Grey. He was one of the first people that looked at telomeric DNA and how telomeres, if you can extend them, it can extend life, is the hypothesis there. And then, of course, Brian Johnson. Karl, who else out there is on your mind?
It's funny, this morning a video popped up on my YouTube feed where Brian Johnson was talking about the health benefits of taking olive oil and adding olive oil to every meal and how it lowers LDL and has all these kinds of health benefits. I don't think that's anything new. I mean, I know Brian has experimented with millions of dollars worth of medicine. So it was interesting that popped up this morning. But Shelby is someone who at Compound has been very interested in this space and has been investing in it. Do you remember how we met, Shelby, Erum?
I can't remember, but I know that we were at a cafe, Devotion, and they were talking about their experience, education. Shelby went to Cambridge, had this really great thesis. The thesis that we all share of biotech really transforming lots of different industries. They work at a venture fund, which is an interesting place to be, of course, because you're seeing so many people that are commercializing science. And what a great conversation. Do you remember how we met, Shelby?
I don't remember how we met, but I do remember that first time we went to go get coffee at Devotion. So I love Shelby. I love the conversations we have. They're a very deep thinker. Last year, they held this Biohacker event that you mentioned, I think last week or the week before. I wasn't able to go this year, but you went. And we decided we'd interview Shelby and bring them back on the pod after that event, which they're going to talk about.
Yes. And we do have an episode where we recapped last year's Biohacker Day. So if you want to go back and listen to that and see how things have evolved since then. But we do ask Shelby about how things have evolved since the first one. But this is going to be such a great conversation. It's on the nose. If you are looking into different types of longevity therapies and want to know what else is out there, this is the episode for you. So let's let Shelby take it away. Shelby Newsad of Compound, we're so excited to have you on the Grow Everything podcast today because we're doing something a bit special. We're having our Biohacking Demo Day recap, something that you have hosted. You've collaborated with Union Square Ventures to host this amazing event, bringing together founders, investors, thought leaders, and simple people like myself. Karl didn't come this year. He was there last year.
Sorry.
But it's incredible. So thanks for coming on and downloading with us.
Yeah, well, it's great to be here. Really appreciate you joining for both events and couldn't be more excited to talk more about it today.
Yeah. So what inspired you, Compound, USV, to create a biohacking demo day? Why are you doing this?
Yeah, a few different things were happening at the same time that we thought were really interesting. Mainly people that didn't come from traditional science backgrounds actually taking health into their own hands and learning about it. And we saw this with a few different Reddit threads like our Biohackers, our peptides. And at the same time, we saw people making new products and people making blood tests that hadn't existed before. So we thought these two things of like increased willingness to experiment and to pay and new products meant that there really is a new category being made here. As we thought about it more, it just made sense to us that this could actually change the healthcare system in its entirety and shift it instead of to the institutions where it is today to the actual individual where we are the executor of our own health. And so, yeah, it was just right time, right place, right technology and right cultural movement as well.
So last year you had written a thesis and painted some pictures of what things might look like in the next few years. But what was different this year? What progress had you seen over the course of the year? And what did you think had changed already?
So our first Biohacker Demo Day was half academics talking about the work that was fresh off the press but hadn't been translated yet. And the other half of the talks were people actually building in the space. But since then, that was September of last year. So in the 9 months since, we've just seen an explosion of consumer biotech companies. We wanted to have another demo day to showcase just how fast this space is moving and how many more products there are for people to try. And the event was also hopefully to spark imagination with people in the audience to be like, now is the time. And there's a lot of different ways that we can use biotech today to give new products to people.
Yeah, I love that. The products to the people. You mentioned that one of the impetus for you to have this demo day and talk about biohacking is the fact that, hey, look, healthcare is changing. People are becoming more empowered. Can you unpack that idea?
Yeah, I think this is the central point of biohacking as well, is that today we have at least 2.5 million paired genotypes and phenotypes. And this is through the form of national scale biobanks, like the UK Biobank and All of Us Biobank in the US, FinGen, which is the Finnish biobank. What we've seen is papers analyzing this biobank data. People with deep learning can actually predict timeline of disease onset and then use feature extraction to understand which biomarkers and genes are predictive of that onset. So one of our companies, proud investors in Fearon, that is using this to help patient enrichment and target selection for traditional pharma companies. But what we're excited about is them continuing to work in this sector. Also, companies seeing the potential of this paired genotype-phenotype data and then using that for more consumer use cases. I can send you guys papers after, and maybe we can put links to this in the description of the podcast, but the data are very compelling.
Yeah, I would love that. We're living in this moment where we're seeing maybe not radical, I don't want to say radical regulatory change, but we are seeing some radical changes. There's this whole Make America Healthy movement. They want to change the way foods are formulated. They're talking about changing the way vaccines are formulated. Synthetic dyes are being phased out. And the whole healthcare system, which is such a huge amount of our GDP, we pay so much into it. And I'm not sure people necessarily are healthier. But how does what Compound thinks about health optimization and biohacking fit into all of that? And what's the investment thesis? Why is Compound interested in investing in biohacking tools?
Yeah. I think these regulatory undercurrents are a bellwether that the societal consciousness is changing about how we're ingesting chemicals in our bodies. And you see this with Nat Friedman's investigation of which foods have the most microplastics. And slightly before that, it was forever chemicals and how they're still in basically all of our food and drinks and have proven to be poisonous and increase cancer risk. Moving towards the investment thesis, what's really interesting to us is that maybe in 5 to 10 years, maybe in 5, definitely in 10, consumer health records will be more valuable than medical health records. And then whoever owns these consumer health records and is able to optimize off of them, those companies become the United Healthcares of the world, or in a good way. And those companies become the next Quest Diagnostics, for example, that is also able to help with health outcomes. That's something that we think is underrated and still not talked about as much, but really shifts the scale in terms of where value is accruing in this area.
And just to be clear, when you say consumer health data, this is the data that people are gathering either on their Apple Watch or their Oura Ring, with their Whoop, with whatever wearable, and also if they're doing any consumer tests. And I'm not familiar enough with this, but are there ways for an individual consumer to aggregate all this and then query it? I mean, I'm sure you could drop it into ChatGPT and query it, but are there more robust tools, number one? And then number two, I see a huge opportunity in terms of making that data more consumer friendly. Erum, here's something we should be thinking about, because a lot of healthcare data is very complicated and there are contradictions in your data that maybe point to something that isn't really there.
Yeah, there are companies which aggregate it. One actually spoke at this most recent demo day. Fulcra Dynamics is what they're called, run by Michael Tiffany. And yeah, his premise was that he's been a biohacker for 15 years. He has all of this diverse siloed data, but he basically built the platform for himself and other people like him. But I think even he's been surprised at how much data is being collected and how that can influence people's responses. So for example, he presented about how his Apple Watch can pick up soundscapes and then tell him where he is in his journey to Boston from the suburb that he lives in. But I think taking a step back, if we're able to layer that with cortisol data in the future and then understand how that impacts inflammation levels, for example, we could start adjusting our environment and our habits to things that promote more health. I'm so of the belief, this is another one of our investment theses, that we don't have enough data today, and people that bring net new data to the industry that's more predictively valid could really increase health outcomes.
Yeah, I mean, I loved Fulcra Dynamics positioning. And what I really took away from that too was the fact that he pointed out that there's a lot of technology that's already created, but it's just hidden. So that Apple Watch feature that you created to monitor the environmental sound and how it could affect your hearing, there's a little feature that he's like, did you know that you could do this with an Apple Watch? Being able to connect that with AI tools, which the APIs for AI, the MCPs is what they're called, being able to connect different data streams to AI. So AI can generate more insights. We know it does a great job. We were using ChatGPT and Perplexity, scanning the web. When it scans your streaming data, your data of your health and what's around you, it's going to be very profound. And he makes it easy for people to do that. That's the goal. But that feeds into the next question, which is there's this demo day lineup had a wide range of startups from Fulcra. Pump.science was there. So people that were doing cryptobiology, solar wearables. So what were you hoping to spotlight in this mix? When you were thinking of putting this together, obviously there were some of your portfolio companies that were there, but there were others. So what was the thesis for this demo day in particular?
Yeah, we wanted to highlight people building in net new spaces because it is pretty new to be able to bet on experiments with crypto tokens.
Yeah.
That's something that was not around even
2 years
5
ago.
Yeah, exactly. Same with ways like NutriOat that are processing oat fiber in order to leach forever chemicals and microplastics from food. That's a real consumer need that is only being proven by people doing more microplastic tests on the food they're consuming. But yeah, wasn't really a market need 2 years ago because a lot of people didn't know about it or its health effects, but it could really change the way we engineer our bodily inputs and optimize those. The idea was for it to be fun, visionary, and new. We have the privilege of seeing a lot of net new ideas, being investors, and really sharing that viewpoint with others is something that we like doing with those demo days.
Yeah, I love it. Talking about fun companies. So I didn't get to go, but I spent time looking at the companies that were going to be there. And one of the ones that really stood out for me was Pump.science. And they're focused on a decentralized approach to science. They take their name from Pump.fun, which is a meme coin launch pad, I guess we could call it. But when you think about this idea of using crypto to fund science, what's your take on crypto's role in accelerating biotech or health innovation?
Yeah, great question. And I think the impact is pretty massive because even 2 years ago, the people that you can raise from, if you're a bio founder, are pretty limited. Most of them are older, stuffier organizations that like certain indications and modalities, but things outside of that aren't as much. And it makes sense for their fund structure. And many funds have really promoted the community and new cancer treatment and immunotherapy treatment by doing that. But crypto is interesting because I think fun is a symptom. What it actually brings is new ideas to the field. When you bring new ideas to the field, serendipity can happen. And serendipity has actually driven a lot of scientific innovation from penicillin, where it was just mold on the scientist's sandwich that fell into a petri dish that allowed us to understand that there was potentially an antibiotic metabolite in there. Serendipity is also, from my understanding of CRISPR discovery, was a big part of that too. So I think that's a bit underrated and under talked about part of crypto funding, but I think it optimizes and maximizes potential serendipity. I mean, Karl, you're big into crypto yourself and have been a crypto maxi for years. So why are you interested in DeSci?
Yeah, it's funny. I don't consider myself a crypto maxi, though I have been in crypto for a really long time. And I think for the same reasons you are. I think that funding mechanisms are broken. There's a lot of places where funding is very challenging. One of the examples, and we've had a couple of examples on the podcast, is women's health. It's just so underfunded. And how is it possible that half the world's population, their healthcare is just not being researched in a way that's equitable? The reason breast cancer is not solved, but prostate cancer is because of the people making the funding decisions. And it's just not fair. So I think that having these alternate funding mechanisms is really important. And what I think about when listening to you, Shelby, I was just thinking about all these other great science projects around the world that are just not getting funded, but could be funded through crypto. On one level, it becomes like a marketing exercise, unfortunately. But if you get enough people who are passionate enough about a topic, about a disease, about a health intervention, and you can get those people passionate enough about it, then you can get that thing funded. So I think that's really exciting to just have that alternate. So that's me on my soapbox, I guess.
Here.
Yeah. What about you, Erum?
Oh, I'm a big fan of it. I mean, I agree with Karl. It's exercise and community building too. Marketing is one thing, you're getting the message out, but people that are really passionate and they need it, they just want to be able to take action and do something versus letting the systems that be create a product that might work and likely will fail or treat a certain population of people. I just love the fact that decentralized approach allows this to happen. And crypto in general, it's exciting. It's just too bad that there's a lot of degens out there. The meme coins just making it seem crazier than it is. It's not branding crypto in a good way. It's taking away from the possibility of it really unlocking a new way of living and being in society and empowering individual people. I hope that changes. I hope Pump That Science does allow some more people to come in. I know there's other efforts that might not be as in your face. Pump That Science is cool. It is going after a certain type of person, but for it to be operational in the background and keep the UX just what people are used to, meet the consumer where they are and let whatever happens in the background change, let it. That's my take. What I really liked about some of these companies was that they really help unveil how your body works and empowers individuals to see what's actually going on. So the testing part, I think, is very interesting because I was doing that myself. I would go to Quest Diagnostics and get my blood panel done and read the report. And now, of course, use ChatGPT and try to figure it out and stalled out with some of the predictions. And it was just one test. But some of the startups that were presented, we had Rhythm Health was there, Mito was there. And the way that they're positioning it, they're building out personalized longevity platforms, enabling more testing so you can have more data points, so you can have better understanding of the evolution of your biomarkers and what direction that they're going in. So do you see this as a new model of healthcare? You mentioned the United Healthcares of the world. Do you see Mito and Rhythm Health falling into that with the monthly testing, the clinician in the loop? I love that, the human in the loop, the clinician in the loop. Talk to us more about that aspect of biohacking.
Yeah, just to give the listeners context, both Mito and Rhythm Health are blood testing companies. They test blood metabolites that can be enriched in different diseases, but their form factor is pretty different. With Mito Health, you go to a place like Quest Diagnostic to get the actual test. And with Rhythm Health, you do it at home. I think both of them have complementary roles in the future because when you get a big blood panel, you probably do need to go to Quest in order to get as much blood as you need to test 100 metabolites or what have you. Whereas Rhythm Health is what 20% of metabolites give you 80% of a picture of how your health actually is. And since it's at home, I think they really thread the needle of being useful and fitting into someone's life to where there can be this seamless functionality and seamless data collection aspect. Blood testing is definitely part of it. We're really excited for companies that do these blood panels and then go a step further as well. We've seen some papers about the proteome and how sequencing the proteome gives you the highest resolution view on disease incidence and disease prediction. I think these companies are proving out that there's demand for blood tests by consumers. We're really excited to see if they keep adding more metabolites to their tests or if there's other companies that come up.
Hi, a quick shout out to our sponsor, Messaging Lab, the force multiplier for biotech. Your biotech company is making the world a better place. You know that, we know that. But does the world? There's a big reason why some biotech companies attract investors, sign up customers, and get attention. That reason is strategic communications. At Messaging Lab, we translate complex science and economics into compelling narratives. And we have done that for the most successful biotech companies across healthcare, agriculture, personal care and beauty, materials, and the list goes on. We're here to make sure your ideas not only get heard, but resonate with your audience. So if it's time to amplify your company's voice, visit messaginglab.com to explore how we can elevate your story and grow your business.
That will be adding broader screens.
Yeah, to me, it's super interesting because I guess most people who go and do an annual physical, maybe you're only getting your blood drawn once a year. I do it twice a year because I have triglyceridemia, so high triglycerides are something I manage. But I often question why so frequently. I do appreciate having a broader panel because then you're able to have a baseline. I think that probably people should have those panels done at a younger age, in your mid or late 20s, so that you can kind of understand how your body's changing. But I really question how frequent they should be. Any insight on that, Shelby?
Yeah, I think it depends on the metabolite and what's going on with your personal health. But I think some trends in data you can't pull out unless you've been tracking it for a very long time and have a lot of data points on it. But I think the world is going towards more consumer health data generally. And I guess my primitive view is just more data is better.
Yeah.
And the more snapshots you have on your health, the better you're able to see if your interventions are actually working. But yeah, I definitely realize there's constraints in terms of how much these tests cost. And I think each person has to decide their own cost benefit analysis for these tests.
Yeah. On Rhythm Health, their business model is a monthly subscription. And he was like, the cost of our service is the same cost as Athletic Greens, which I thought was a funny comparison because it's a pricey product. But I think with the frequency, one of the philosophies you pointed out, Shelby, was that we're going from the sick care system, then we have this healthcare system, and then we have health optimization. So it sounds like depending on where you are in your journey, if you're tracking biomarkers to resolve a disease, then to get to a baseline, and then to optimize those biological processes, you'll want to be able to get a reflection of your health. But the side thought is that, at least when I go to get blood tests, and I don't know if I should be giving my PHI out, Karl, you did, so I feel emboldened to share my personal health information. I genetically have higher cholesterol. They're like, all right, well, don't eat any cholesterol for all this time and then come and get your blood taken. I'm like, but that's not how I live my life. Why are you forcing me to adjust my data? I want to be able to get data that is a true reflection of my lifestyle. Because then if I see it, okay, I have really high cholesterol because I had Chinese food yesterday. Not to say Chinese food's high cholesterol, but I'm just pointing out, just picking one. And then I'll know, like, okay, maybe I shouldn't eat that much because I see that my cholesterol is so high that I'm not going to do that as much, because then you start seeing reflection. Like that mirroring, I think, is so important, because then you're like, okay, no one's preaching that I should eat less cholesterol. I see the data for myself, and there's no lies, there's no bias, there's no agenda. It's just the truth. And then I have to make a decision.
And I think what'll happen, and Shelby would love to get your point of view on this, is that having more of that data and having AI interpret it for us will make those interventions easier to add to our lifestyles. I'd like to think that's the direction we're going to go. What do you think?
Yeah, I mean, I definitely agree. I on and off use a consumer continuous glucose monitor. That was really the moment that I became a true believer in biohacking, because you could see the difference in blood spikes if you ate a salad where it flatlines versus ate ice cream where there was a really sharp peak and then a drop where you felt drowsy after. But being able to correlate how well I felt and how drowsy I was to my blood glucose in real time, that's when I was like, okay, what we're doing here for glucose, we can do this for everything in our bodies. This is really like what you were saying, Erum, with cholesterol, this cause and effect. It's just easier to take people's advice if you can see yourself that it's working how people say.
Yeah, exactly. So speaking of interventions, the king of biohacking and interventions beamed into the demo day. Brian Johnson was there, and he shared some of his latest interventions. Were there any takeaways from his talk that surprised you or resonated with you? It was very interesting to speak to him.
Yeah, I think the biggest thing was his shift in what changes people's minds. He thought having the best biomarkers in the world or the slowest aging score would make him famous and make people like really jump on board to his stack. But what he came up with in the end is that people just care about looking hot and feeling good. And those are pretty good proxies for how healthy people are. So I really liked how candid he was in terms of sharing his internal thought process and his internal evolution for how he thinks about and markets what he's doing. And then the hyperbaric oxygen therapy, for him to have maxed out his biomarkers all that he could, doing his blueprint stack and doing his pretty intense exercise regime, for him to be able to materially move his biomarkers by doing hyperbaric oxygen therapy was something that was pretty interesting to me as well. But I wonder what you thought, Erum.
Yeah, I agree with you. And I love that you shared how candid he is. He's always candid. I think you were there too. We saw him talk at DSI. He was at Synbio Beta. And if you really hear him speak, I think he's actually a very authentic person. He's not trying to sell you any of his products. He doesn't actually ever talk about his products when he's at a conference or a talk. Maybe at the Don't Die Summit. I haven't gone to those. But he did say about the hyperbaric chamber, he's like, look, I am in a privileged position to have one in my house. I have one that has a desk inside of it so I can just do work and get the treatment. He's like, it's not realistic for a lot of people. He's like, I just wanted to share that with you because it's expensive. And he also talked about even if you were to commute to a wellness spa or somewhere that has a hyperbaric chamber, traveling back and going home afterwards might reduce the effects of it. So he was being very thoughtful about it. I don't foresee that he's like, okay, I'm going to create a whole suite of hyperbaric chambers and try to sell it to you. People think he's just saying these things to sell his product. Of course he has products. He's trying to provide something to people to give them a place to start and think about it. He still has the microplastic testing kits, which I think are very interesting. Again, we talked about the mirror of being able to see the data and see for yourself how much microplastics you have in your body. And one metric he pointed out was that when people are getting IV treatments, the plastic IV bag emits about 40,000 plastic particles that goes through the IV bag into your body. So that's something that he said. And I was like, oh, interesting. I didn't look deep into this number, but it was basically pointing out that, hey, look, plastic's pervasive and it's used in the medical establishment. And none of this is intentional, but now we're discovering that microplastics are in our body and they have different effects in our body. So we just need to be aware. But then he's gotten his microplastic exposure down to 1 particle exposure. And I was just like, wow, well, good for you. It makes sense. I'm glad everything he's doing is working out. His blueprint stacks all the products that he's created that are tested for microplastics to make sure that they are sourced while they're the cleanest, because he is putting it in his body too. So he's living his truth. He's sharing it. And it's always a pleasure to hear him talk because he is a big thinker too, because his big takeaway is like, look, someone asked a question like, what's something that's going to surprise you? What do you think is going to surprise us and people when it comes to biohacking? And he pointed out now AI is going to surprise us because it's just, we can't surprise ourselves anymore. AI has to be the one to surprise us, but we have to just make sure that it's human-centric, make sure it's not AI dominant, but that it takes humans into consideration. We still have control over the situation. I appreciate that. It's great that you got him. I just felt like it was icing on the cake of a Biohacker demo day cake. So It was great.
Really grateful he could join. And I think just to maximize fun for these events as well, I think having someone that is really a visionary in the field. Last time at our previous demo day, Josie Zahner spoke, who was one of the first people to CRISPR themselves and now has a really amazing company that's optimizing animal traits to make companion animals more interesting, more cute. And it's great. Josie at our previous demo day talked about the feasibility and that her goal really is to make fire-breathing dragons with biology and engineered complex traits in organisms.
Yeah.
I'm glad you enjoyed that, Ewan.
Yeah.
I'm also with Brian. I think with Brian specifically, I'm always interested in what's the MVP. I think what's interesting about the whole Don't Die movement is the people who get into it, but do their own hacking and figure out what really works best for them. I think that people should realize that it's not necessarily that you got to take all these supplements and eat this crazy diet and do this crazy exercise. Staying healthy tends to be something that's pretty simple. A lot of our civilization-wide lifestyle makes us unhealthy. So being more aware is often all that it takes. But I love when people talk about the simple things. I'd be super curious from Brian's point of view, what are the few things that really made the biggest impact for him?
Mhm. Yeah, probably just nutrient maxing and exercise and sun.
Sleep is a big one.
Sleep. Yeah. That would be neat if he just went with the everyday person's blueprint. What would that look like?
Basic, and then the middle tier, and then the premium tier. What are the tiers?
Exactly. Yeah.
Yeah, I love it. I love it. So moving on, clearly Compound is looking at some of the cutting edge science and technology that's out there. So how do you guys weigh scientific risk versus cultural momentum when you're investing? This is a very interesting area, it's biohacking space, because you're talking about human bodies, but there are people that are doing it. So how do you think about that?
Yeah, I think that's what makes it so hard to build in this space, because you need legitimate novel science, and you also need to be excellent at market and branding and serving a real need for customers that they can immediately feel. For us, founding teams become very important of who is driving home the science, who is excellent at marketing and branding. In many ways, we diligence consumer bio companies in a similar way of, does this actually check out? Are there priors of different technologies where you can get data readouts at this point? But having answers to go to market, margins, and also scale of companies, scale of these products, and ramp of shipping is something that we look at as well.
Cool.
And there's this whole thing where people say biohacking is inaccessible or it's elitist or super niche. What do you think needs to be changed for that to not be the case, for it to be really widespread and everybody have access to it and realize that they are in charge of their own health?
Mm-hmm. Yeah, that's a good point. I think one thing that New York does pretty well is subsidized fruit and vegetables. The fruit stands on the street are pretty cheap and give pretty big population access to really healthy foods. In some ways, I think as these things commoditize as well, as blood tests become cheaper, as it becomes easier to make new supplements that we find are effective, capitalism and competitors coming into the space also does drive costs down as well. But in order for it to be financially viable for a lot of companies today, I think they have to start at a higher price point and then drop it as they fight to keep their market position. Just like iPhones were for really wealthy people initially, and then 5 years later started to be at a price point that was accessible to the audiences. I see biohacking taking a similar route.
Nice. Nice. And biohacking is very broad. There's a lot of things that people can start using today. There's some things that are a bit weird. People are trying different things. You were at Synbio Beta on a panel and you talked about the world of gray peptides and how that culture is today and how you participated in it. But maybe you could talk to that a little bit. But what are some of the weirdest or most delightful interventions you saw or tried? What can you care to share, Shelby?
Mm-hmm. Yeah, I mean, I think the continuous glucose monitor is the one that's given me the best feedback loops to how measuring your health data can lead to better nutrition, because you just do have cause and effect right there. And I think anything that gives you cause and effect immediately, I know we've talked about this a lot before, but Z-Biotics hangover cure, the fact that you can feel the next day that you're not hungover is real incentive to keep buying. I think there's a massive opportunity in skincare, because you see your own skin multiple times throughout the day and are always tracking, do I have blemishes today? Do I have acne? Do my wrinkles look more pronounced? One of the serums I use is by Dinde, the debut Biotech consumer arm that's using anti-inflammatory small molecules to increase skin health. But I think that's been my favorite skin intervention, because within a week of using it, my pores did look visibly smaller.
Wow.
And that's something that really changes how your whole face is perceived. So yeah, I would say Dinde, continuous glucose monitor. I guess another one is NMN, the supplement NMN, nicotinamide mononucleotide, which is a precursor of NAD, which is important for cellular energy. When I take that supplement, I really feel a steady energy increase throughout the day. And then nicotine, I use nicotine patches in the afternoon instead of coffee.
Did you say pouches or patches?
Pouches.
Nicotine pouches. Elaborate.
Yeah. Yeah. The one I use is a healthy version of Zyn. The base is an oat fiber, and they add fast and slow acting nicotine to that. Package that in a little white pouch. I just put that in my gums and use it to help me with alertness and acuity. And nicotine is great for optimizing focus.
And how does it impact your sleep? Does it at all?
It doesn't. I only use them in the early afternoon. And for me, the effect lasts for a couple hours, but I haven't had any problems sleeping after then.
I've heard it's a travel hack to avoid getting sick on airplanes is wearing a nicotine patch. And I haven't gone down the rabbit hole, but I'd heard that COVID affected smokers much less than other populations. I don't know if that's true. So if you're listening to this, don't take that as advice to take up smoking.
Yeah, I have seen small long COVID studies where people have hacked out of their long COVID by nicotine patches or pouches. And actually, one of my friend's moms did that and seemingly cured herself of long COVID with nicotine.
Yeah.
But I think the peer-reviewed studies that I saw were small. So definitely do your own research before you try using it.
Right. And what's one biohack you think should become completely normalized in the next 5 years?
I think it is proteome sequencing.
Oh.
Because since proteins are the chemical effect, they're the machines of our bodies. The papers that I have seen suggest that they're the most predictive of your overall health state. Everyone having access and sequencing their body's proteome, I think is really helpful. With that, I'm really interested in companies that help biobank people's samples over time. I think young people should be biobanking their samples. I want someone to take my blood every month and then store it for me so I can give myself blood transfusions when I'm 60 years old of my younger body's blood. So I think there's all of these things that would be safe, probably would help my body as well. So there's a lot of these things that aren't too crazy scientifically, but could be a big helper in the future.
Yeah. How would someone get their proteomes sequence? Are there any services today? I know that there's some whole genome sequencing services. Could you use the same ones in different analytics on that? Tell us a little bit more about it.
Yeah. So people are using nanopores to sequence proteins instead of DNA and RNA. Mm-hmm. You do have to do some adjustments to the nanopores, I believe. But there's also ways through Olink and SomaLogic through antibody technology where you can get a picture of what your proteome looks like. And those are the technologies that the UK Biobank and all of us have used in order to get protein profiles of patients. But those are somewhat limited. We have 20,000 unique proteins that we express. I think SomaLogic and Olink, they're in the low thousands of proteins that they monitor. So really interested in technologies that allow us to do pan-proteome monitoring. I think nanopore could be a good tech in the future to allow that.
All right. You heard it here first, people. If you're creating a proteome sequencing product, hit up Compound.
Yes, please. Shelby at compound.vc.
Oh my God, that's awesome. I think we're at the stage, we're doing something new, Shelby, and you're the first person to experience this. Go within quick fire questions. Okay. Karl,
excited.
you and I will go back and forth. I will start. All right. First biohack you ever tried?
Inamin.
Oh.
Amazing. Coffee, cold plunge, or creatine? What's non-negotiable?
Creatine.
What's on your nightstand right now? Book, wearable, or supplement? She's looking.
Book.
What book?
The book is actually about boundaries and having boundaries in relationships and how that can help free your time.
Okay, so this is very funny because I mean it is a boundary to ask, so I broke that boundary. So I apologize.
Yeah, you did.
So meta.
What's the weirdest thing you've ever seen in a pitch deck?
For me, the weirder the better. Outside of pure biotech, might be surprised, is shark antibodies. Shark antibodies are really small. They're about 1/10 of the size of ours. people are trying to use those to make new biologics.
Oh, wow.
Amazing.
Sharks live a really long time. Very interesting. Okay, last one. In one word, the future of health is
Personal.
yes.
So awesome.
Shelby, oh my goodness. You're so amazing to speak with you. You're one of the leading thinkers in the space, seeing it all. You're investing in the space. We love talking to you about biotech. Thank you for coming on the Grow Everything podcast to share your thoughts. We'll have you back on. You've been on the podcast before. You've helped co-host a podcast. We'll have you back on again for sure.
Thank you, Shelby.
Thanks for having me. Always great to chat with you guys. Appreciate it.
All right, Karl, what did you think of that episode?
Like I said at the intro, Shelby's a super deep thinker. And so I really appreciate that they're a friend of ours in our network. And they just think very deeply about these subjects and brings a really interesting, fresh perspective. I super enjoyed the interview. I regret that I wasn't able to go to the Biohacker Day number 2. I did have FOMO that day. You and I were texting each other, but I had other things I had to take care of. What about you?
Yeah, well, you missed a lot, but then at the same time, we gave a great recap. So it was like you were there. And of course, I met with a bunch of people that were presenting, and we'll connect with them. We might have a couple of them on the Grow Everything podcast to go deeper into what they're doing when it comes to looking at how to optimize biological processes. I just loved the way that we navigated the different interventions, the different ways of testing, really making data more visible to us consumers, us individuals, so we can make better decisions. When it comes to our health, people are starting to see that if you've used AI for your health, let's just say that you can be asking simple questions, but then if you're sharing data and it's telling you something about your health, that's a very profound experience because you're like, all right, well, the information's there. So I have to make a decision. Am I going to continue living my life like X, or should I go living my life like Y, which is going to result in healthier outcomes for myself? And I think that it's super great to be able to see what's out in the market because there's so many things that are going to come out, some really authentic things that work and some things that are going to continue to be snake oil, which, by the way, is Brian Johnson's olive oil brand. It's called snake.
Oh, I didn't know that.
Yeah, it's called snake oil. So he's playing into it because people think the whole controversy is, oh, he's doing all of this as a way to sell product. But I think seeing Brian Johnson speak in small environments like we did at this Biohacker demo day and at these events where we've seen him speak comes off as very authentic. And I'd be curious to know how much money he's actually making from these product lines. But again, I think he does need to put a roof over his head, even though it's a very expensive roof. But still, anyway, it's cool that we get access to these types of thinkers.
Absolutely.
We need to be vigilant. People have good intentions.
Yeah. And one other thing I would just say to listeners is if you haven't seen Shelby's writing, Compound at their website has a collection of things that Shelby has written about, a whole manifesto about what the biohacker future looks like. It's got some very interesting scenarios as to what could happen in the next 3, 5, 10 years, 20 years. They've also written very deeply about protein dynamics and bioplatforms and autonomous science, which is a thing, and cell therapies. We just talked about cell therapies at the beginning of this episode. So it's worth looking into the things that Shelby writes about because it's very much in line with the things that we talk about here at Grow Everything.
Yeah, it's super interesting. And we're lucky to have a physical copy of their manifesto. It's a lot of work to create physical designs, but they did it. And it's really beautiful. It's really well done. The cool thing is it's a look into the future based on all of their experience looking at what's going on in the market, how things enter the market. So it helps you think about what's life going to look like for us when we get older. And for me, it's personal because in my previous life, I was a founder and I sold into the senior living industry, which today is not that cool, Yeah. So how does that change for people like us? And I still have friends that work in this space and they ask me, what does senior living look like to you? And I'm like, it looks like traveling and being mobile and doing all the things that I want to do if I'm not working. Although I do want to continue working. You and I talked about this. You're like, I don't really see myself not being curious and wanting to do things, maybe not 9 to 5,
Right. I completely agree with you. I mean, that is what we all hope for when it comes to becoming aged, staying active, doing interesting things, having good friends, and maybe doing a little bit of traveling.
Yes. That's the pod. We have some great guests coming up. Stay tuned. People that are working in, of course, the space sector, space biotech we love, and people that are running large community events in the world of biotech. We have Suzanne Lee's episode coming up where she's doing a new type of biofabricate. We have our friend Casey Lardner of Gen Space Executive Director. They're on to amazing things, so please stay tuned. Please like, subscribe, and of course, reach out. We love hearing from you.
Yeah, make sure you like and subscribe us on YouTube. We are doing a lot more posting there, and we're seeing a lot more activity on our YouTube channel.